A 72-year-old man presents to the clinic for evaluation of a lesion on his nose and has been growing larger for the past 2 months. The patient notes no history of trauma, pruritus, or pain, but states that the size of the lesion is making his nose feel uncomfortable. On exam, the nodule is pink with rolled borders. Telangiectasias are present within the lesion with central ulceration. What is the characteristic histologic appearance of this lesion? Keratin pulse, palisading nuclei, sawtooth lymphocytic infiltrate, atypical melanocytes, or epidermal hyperplasia with cutaneous tapping. This is basal cell carcinoma here, and the description is there is pink nodule with rolled borders. This is very classic for basal cell carcinoma. Another one is telangiectasias. So whenever you see telangiectasias or rolled margins or rolled borders, pink flashy nodule, this is classic for basal cell carcinoma of skin. And the histologic exam here is palisading nuclei. I have here. What is palisading nuclei? It is this. You see here, all these cells, they are arranged like this everywhere. I hope you can see what I'm drawing here, all this. Anything arranged like this is called palisading. And these palisading, you see here everywhere. These palisading nuclei are classic for basal cell carcinoma. So in exam, you can either be given a description that a histology slide revealed palisading nuclei and what is the diagnosis, or they'll give you this picture of this slide and you have to figure out that these are the palisading nuclei, the diagnosis of basal cell carcinoma, or they'll give this description and you have to tell what will you see on the histo, right? What about the other options? Keratin pearls. This is classically seen, a lot of you chose this option. This is classically seen in squamous cell carcinoma. Okay, and keratin pearls are, this is very important, and keratin pearls are found not just in the squamous cell carcinoma of the skin, but keratin pearls is general for squamous cell carcinoma everywhere in the body. Uh, this is the keratin pearl here. You see this? This. So this is squamous cell carcinoma of skin with keratin pearls. Now, how will you differentiate it? I know it is confusing with the stem cell. How can with the question stem? How can you say whether it is squamous cell or basal cell? There are some clues. Importantly, squamous cell carcinoma is usually seen on the lower lip. That is one differentiating point. Another thing is it will be given as a lesion, a patch with ulceration. Okay, that's the classic description there. And there will not be telangiectasias or rolled margin. And another thing is that it will be scaly. Okay, it is a scaly plate with or without ulceration, and there will be some crusting. If it is a crusting scaly plate, which you can make out either on the picture or from the description, then it is squamous cell carcinoma. But if it is flashy pink or pearly nodule with telangiectasias, then it is a basal cell carcinoma. Right? What about other options? Sawtooth lymphocytic infiltrate. Now, in which condition will this be seen? Okay, it is seen in lichen planus. And how will lichen planus be given in the question? It is classically all those PPPs that you see. They are polygonal, purple, pruritic, colored lesions. If that is a description, then it is lichen planus, classically associated with hepatitis C and some drugs like thiazides. And the histo will show show a sawtooth lymphocytic infiltrate, which is seen here. Okay, do you see all these? These are all lymphocytes here. All these here. These are the lymphocytes, and You see this? This is the classic sawtooth appearance of these lymphocytes at this dermal epidermal junction. This is seen in lichen planus, and the classic description will be purple pruritic polygonal papules. Atypical melanocytes. This is seen in case of malignant melanoma, and the description of malignant melanoma will be, your A, B, C, D, E, right? What is A, what is B, what is C in case of a malignant melanoma. It is not the description here, and so that is not the answer here. The last option is epidermal hyperplasia with cutaneous darkening. Uh, this is uh, this is a classic appearance of acanthosis nigricans, where there will be blackish color on the armpits or around the neck. It is seen in case of PCOD, where there is glucose intolerance. Okay, or it could be also a sign of an underlying malignancy sometimes. Now, what is the ABCD? There is asymmetry, there is irregular border, there is irregular color or variegated color appearance, different color. The one lesion has different colors in different parts, and diameter and elevated, or not elevated, I think it's evolving, meaning it is increasing in size, not remaining constant. Increasing in size, changing colors, basically evolving.
Thanks for watching. Please give a thumbs up and subscribe for more.